News, views, voices of the global Indian community. India abroad.
Calls for a longer discussion. So I think there are.
Portugal's village my great grandmother. So it's a local.
You might say specific to high schoolers, but we are open to anyone. You're basically a high schooler. Yes.
ICA was formed 56 years ago by a group of students from Berkeley and Stanford, and they used to save $5 from their salary every year and send it back to India to help NGOs. And one of their first projects was a bridge that they built. There now we've reached a point where we are sending millions of dollars every year. We have supporters here, supporters like you, who help us and donate whatever, from $100 to $100,000. And we pick charities in India. We vet them so that you're not giving money to somebody who's going to, bamboozle with that money. And after we check them out and you want to donate to them, you're happy to do that, and we will make it happen. Because a lot of the charities in India cannot receive dollars. So they need a party like us to do it. And people here get hoodwinked all the time by so-called charities. We give money if somebody has FRCA, which is, means that you're a legitimate charity.
So for several years, ICA has always supported healthcare, especially with an emphasis on women's problems in India. We've worked with a lot of non-profits, even in remote areas like Jhagadia near Bharuch in Gujarat. They've worked with problems related to lack of sanitation and sanitary napkins, and so they're working with a specific group on that. And this year they have actually, since the last couple of years actually, they have been repeatedly inviting people who have spent their lives in trying to help tribal populations in very dense jungle areas with access to healthcare and hospitals.
More than 140 per thousand live births, which was nearly 2.5 times that of rest of India. The prevalence of severe malnutrition was more than 20%, which is again worst as compared to most of the African countries like Sudan, Ghana, etc.
A physician couple, Dr. and Dr. Mrs. Satav, who have arrived from near Nagpur, and they are both running a 24-hour hospital virtually, and they see several patients with a variety of problems. They have a small ICU on the campus itself, 4 other doctors who are available 24 hours along with these 2 individuals over there. It's an amazing effort and an amazing commitment of a life.
All sorts of patients like cancer of the breast, parotid tumors, cleft lip, cleft palate, postbone contractures, they started coming to us. Because of our service, research and policy advocacy, we could significantly improve the life of around 1 billion tribal people across the state of Maharashtra.
Thank you, Reshmaji, for your kind words of introduction. Mr. Prakash Agarwal, President, Indians for Collective Action. Mr. Mike Moritz, distinguished members of the ICA, Collective Actions, which was set up 56 years ago with the intention to support the Indian NGOs in providing healthcare, education, rural development, and also like other social sectors. I think already I've seen from the presentation that you're supporting certified NGOs in US and also in India. And I've seen you're also trying to connect the NGOs in the US with the NGOs in India through your due diligence.
About it, I'm very happy to talk more. So before I get into our little conversation today with these experts and I introduce them, a couple of things, because we have
this Bay Area with venture investment and community development.
Thank you.